Hello and welcome. Today, we're diving deep into a less commonly understood, yet potentially debilitating condition, autoimmune vertigo. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. So, let's embark on this journey to understand autoimmune vertigo. The etiology of autoimmune vertigo is, unfortunately, not fully understood. What we do know is that it's believed to be triggered by an autoimmune response. This means the body's immune system, which is normally designed to protect us from invaders like bacteria and viruses, mistakenly attacks healthy cells in the inner ear. These inner ear structures are crucial for balance and spatial orientation. This autoimmune response may be triggered by a prior viral infection, another autoimmune disease, or in some cases, the trigger remains unidentified. The exact mechanisms that lead to this misdirected attack are still actively being researched. Now let's look at the pathophysiology, or how this disease actually works. In autoimmune vertigo, the misguided immune system produces antibodies or immune cells that target the inner ear. These antibodies and cells can damage the delicate structures responsible for sensing head movement and position. This damage disrupts the normal signals sent to the brain, leading to a mismatch between what the eyes see, what the inner ear senses, and what the brain expects. This sensory conflict is what ultimately causes the sensation of vertigo, that spinning or whirling feeling. When it comes to epidemiology, autoimmune vertigo is considered a relatively rare condition. Precise prevalence figures are difficult to obtain due to the challenges in diagnosis and the potential for misdiagnosis with other vestibular disorders. It is believed to affect women more often than men and typically manifests in adulthood, often between the ages of 30 and 60. Individuals with other autoimmune diseases, such as lupus, rheumatoid arthritis, or multiple sclerosis, may be at higher risk. The signs and symptoms of autoimmune vertigo can significantly impact a person's quality of life. The hallmark symptom is, of course, vertigo itself, which can range from mild dizziness to severe spinning sensations. This vertigo is often episodic, meaning it comes and goes. Other common symptoms include imbalance, nausea and vomiting, hearing loss, tinnitus or ringing in the ears, a feeling of fullness in the ear, and in some cases, visual disturbances. The specific symptoms and their severity can vary greatly from person to person. Diagnosing autoimmune vertigo can be a complex process, as its symptoms can overlap with other inner ear disorders. There is no single definitive test. The diagnostic process typically involves a thorough medical history, a physical examination including neurological and otolaryngological assessments, and various hearing and balance tests such as audiometry, electroanastigmography (ENG), or videoanastigmography (VNG). Blood tests may be ordered to check for markers of autoimmune activity. In some cases, imaging studies like MRI may be used to rule out other potential causes. A positive response to immunosuppressant therapy can also support the diagnosis. While there isn't a strict classification of types for autoimmune vertigo, it's often categorized based on whether it occurs as part of a broader systemic autoimmune disease or as an isolated inner ear problem. When it occurs in conjunction with other autoimmune conditions, it's referred to as secondary autoimmune vertigo. If it occurs in isolation with no other identifiable autoimmune diseases, it's classified as primary or idiopathic autoimmune vertigo. This distinction can be important for treatment planning. The treatment and management of autoimmune vertigo primarily focus on reducing inflammation and suppressing the immune system to prevent further damage to the inner ear. Corticosteroids, like prednisone, are often the first-line treatment to reduce inflammation and suppress the immune response. Immunosuppressant medications, such as methotrexate or azathioprine, may be used for longer-term management to prevent relapses. Vestibular rehabilitation therapy, a type of physical therapy, can help improve balance and reduce dizziness. Additionally, medications to alleviate nausea and vomiting, as well as lifestyle modifications, can help manage the symptoms. Unfortunately, there are no known methods to definitively prevent autoimmune vertigo. Since the exact triggers are often unknown, preventative measures are limited. However, managing underlying autoimmune conditions effectively may potentially reduce the risk or severity of inner ear involvement. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, can support overall immune system health, though this is not a guaranteed prevention strategy. The prognosis for autoimmune vertigo can vary. Some individuals experience significant improvement with treatment, while others may have persistent symptoms. Early diagnosis and treatment are crucial for maximizing the chances of a favorable outcome. Research is ongoing to better understand the underlying mechanisms of the disease and to develop more targeted therapies. Current research explores the role of specific autoantibodies, the potential for gene therapy, and the use of biologic agents that target specific immune system components. These advances hold promise for more effective treatments in the future.